Hello, welcome to week 9. This is the project, and my name is Kevin Tenkku. The agenda today is the role and importance of quantitative and qualitative methods, public health and the science of prevention, and public health and ethics, which is true to my heart. And then after that, I have my references, and if you have any questions, feel free to ask. The role and importance of quantitative and qualitative methods are imperative to use as a tool to manage different programs. And these tools provide statistical tools as well as deep insight that provide data to test and manage through the observation of trends. Qualitative research at its core asks open ended questions whose answers are not always easy, but in numbers, but it tells you how and why. Qualitative research is a method used to understand the experiences, concepts, and motivations through the use of non numerical data. Often it uses interviews and tries to understand the hows and the whys behind the numbers and the data. Qualitative research gathers participants' experiences, perceptions, and behaviors. I perform both quantitative and qualitative research. And I do this a lot of times in employee investigations. For example, the numbers and data sometimes can be skewed, but often the real danger is the qualitative research, or in my position, employee interviews based on qualitative research. For example, an interview with a doctor may be biased in his or her interest versus a medical assistant. The questions may be different in the interview. The understanding of the qualitative data may be skewed based on bias. I notice that doctors are often given more leeway in interviews compared to medical assistants simply because of their position. The doctor may be guilty of an infraction, but the interviewer lets the doctor off easy when the same interview with the same infraction doesn't let the medical assistant off that easy and wants to make sure the medical assistant is punished and let the doctor off. Another example, I've seen interviews done, they ask questions based on whether the interview likes the person or not. This is done despite the employees having duplicate infractions and similar evidence. Therefore, it is my preference to use both the quantitative data as well as the qualitative data in order to get a potential complete picture. Bias can be argued in a qualitative research investigation when compared to the data quantitative, which may confirm or may suggest a different result. The science of prevention focuses on the development of evidence based strategies, reduce risk factors, and enhance protective factors to improve the health and well being of individuals, families, and communities. Social behaviors. Understanding social determinants of health is critically important to developing effective public healthcare policy. Social behavior of groups and individuals is shaped by the broader social environment, including such factors as the laws, enforcement, media, strength of family, and other social relationships, sense of shared responsibility for the quality of life in the community, and beliefs. Prevention in clinical care services is critically important. Prevention care and clinical care services is essential to public health. Healthcare providers need to prioritize the implementation of preventative care services, even when clinical interventions are necessary, and overcome barriers to preventative care. By investing in preventative care and implementing these strategies, healthcare professionals and practitioners can play a crucial role in disease prevention and contribute to the well being of individuals, families, communities, and countries. Secondary prevention focuses on early detection and prompt intervention to prevent the progression of diseases. Tertiary prevention manages the consequences of these diseases by restoring health and providing rehabilitation. Another giant factor is government services. And throughout the United States, there are federal, county, and city governments that offer inpatient and outpatient medical facilities and services. However, From 1975 to 2008, the total number of hospitals in the United States dropped 19%. One third of the beds were under federal government auspices, and they fell by one half, reducing a proportion of the total hospitals from 10 to 5% in total. This shortage has created healthcare services that are provided by the government, and it has put an ever increasing strain on the public healthcare system. Although nonprofit and for-profit healthcare systems absorb part of the impact, the shrinking scope of public health services has increased pressure on emergency departments nationwide. The Emergency Medical Treatment and Active Labor Act of 1986, signed by Ronald Reagan, also called EMTALA, require all people that go to the emergency room to be treated despite insurance and even citizenship. This serves for the public good, but it does strain healthcare systems. Public health ethics is a multidisciplinary field that addresses the moral principles and challenges involved in protecting and promoting population health. Unlike clinical ethics, which focuses on patient physician relationships, public health ethics concerns itself with the collective well being of the communities and the balancing of individual rights against societal benefits. Several core ethical principles guide public health decision making. Public health actions should aim to maximize well being while minimizing harm. For instance, vaccination campaigns prevent disease outbreaks, but must also consider the rare risks of adverse effects. Let's take justice and equity. Fair distribution of health resources is a central concern. Public health programs must consider vulnerable populations, ensuring they are not disadvantaged. Let's also talk about respect for autonomy. Although collective welfare often takes precedent, respecting individual choices remains important. Ethical tensions arise when personal refusal of health measures threatens community safety, as seen in debates on mandatory childhood immunization. And there also needs to be transparency and public trust. Ethic, Effective public health relies on community trust. Policy should be communicated openly with evidence based justification to encourage compliance and maintain legitimacy. In conclusion, the three selected topics are crucial for the effective management of public health policy within the government and institutions. While ethics is particularly significant to me, all three areas, public health ethics, science of prevention, and the role of quantitative and qualitative methods, are important subjects that warrant further exploration and learning. The understanding of public health and the science of prevention is a key building block of public health. Thank you for listening and viewing my PowerPoint. Does anybody have any questions or responses at this time?